Welcome to Share the Health, a new podcast from the Ross County Health District, where we discuss health issues that affect our community. I'm your host, Sarah Smith. Today I'm joined by Ross County Health District Director of Environmental Health, Kelly Spindler. Welcome, Kelly.
Thanks, Sarah. I'm glad to be here.
So how long have you been with the Health District?
Well, I have 30 years in public health as of a couple of months ago. I started my career in Pike County for a couple of years, and then I came here to Ross, and I was here for 16. My family, we moved away. I worked in Fairfield County for several years, and I came back here in 2021. So I've been back about 4.5 years.
Oh, wonderful. Well, we're glad that you're back.
I'm glad to be back.
Yeah. So can you describe your role with the Health District?
Sure. As you said, I'm the Director of Environmental Health, and we cover several programs here at the Health Department. We have a very large sewage program, meaning septic systems that are to be installed, and land needs to be split, sewage nuisances. We do soil evaluations now. Shout out to that. We hadn't done that for several years. We started that back up in April. We do the food program. So any place you go to eat food or buy food, more than likely it has a license from us, and we inspect it. All the restaurants, all the grocery stores, gas stations, dollar stores, all of that. We do inspections on those. We do all the public campgrounds, all the public pools. We do the rabies program, meaning when an animal bites, we do an investigation for that. It's how we track rabies in Ohio. We do a solid waste program. We do commercial plumbing. We have a plumbing inspector housed with us, and he does all the commercial plumbing inspection. And, of course, we have a vector program.
So what exactly does vector mean?
So a vector is an organism. It's typically a biting insect or a tick, and it transmits disease or a parasite from one animal to another. So it's that transference of disease or the ability of transferring disease.
So speaking of mosquitoes, are we still in the height of mosquito season, or how long does that last?
We are still in the height of mosquito season. So Ohio's mosquito season is typically May to October, but until we have that first hard frost, we will have mosquitoes.
Yeah, it's still been pretty warm here lately. It makes me wonder how far off we are from that.
Oh my gosh, it feels like midsummer again.
Yeah, it really does.
Yeah.
So how dangerous are mosquitoes?
Well, they can be dangerous, yes. So according to the Ohio Department of Health, we have 59 species of mosquitoes in Ohio, and that's a lot.
That is a lot.
But only a few of those carry disease. So typically, even though we're identifying, we really pay close attention to those that we know carry disease.
Mm-hmm. So there are some that aren't as harmful potentially.
Exactly. They're a pain. You know, they bite and they itch, but they're not going to transmit a disease to you.
Yeah. And then when you're just out and about, it's probably really hard to know which breed of mosquito is this? Is this one going to hurt me?
Yeah, exactly. And you've already got the bite before you have any idea what it is. So you just assume that there's a potential for transmission. Mm-hmm. So I can go through a few of those mosquitoes that we are particularly concerned with in the state of Ohio. Okay. So the first one is the northern house mosquito, Culex pipiens, for the genus and species name. Yeah, something that, make you sound smart. But so that mosquito is found all around Ohio, and they like to lay their eggs in stagnant water, catch basins, ditches, containers of water with high organic matter, flower pot saucers, and clogged rain gutters are a big one. So this is the mosquito that transmits West Nile virus, that we do a lot of work and tracking of that. They also carry St. Louis encephalitis, but West Nile is the one that has been a big topic for the last several years. And so this mosquito is active dusk till dawn, typically. So when you're out in the evening and they really start coming out, this is one of those main mosquitoes. So, and this is the mosquito that gets put into pools and tested by ODH lab. And we'll get into that, some of that, what we do with that. So West Nile virus was first identified in Ohio in 2001, and we now know it's well established here. Some people may remember several years ago when people were asked if they found dead birds, if they would report it to the health department. So back then, I was working here, we would get lots of calls like that, and then we could pick them up, send them for testing. So what they were trying to figure out at that time is West Nile here? Has it become established? And so we would send those birds off, and then we still get calls of, hey, I found a dead bird. Would you like to send it for testing? We still pay attention if there would be a lot of dead birds in an area, but they don't really do the testing anymore because we know it's here and we know it's established. Mm-hmm. So
are they more susceptible to West Nile?
They are. They feed from a bird, and then they get West Nile, and then they bite us, and they transmit it to us. So another mosquito that we see quite a bit is the eastern treehole mosquito, Aedes tricereatus, and it is also found all around Ohio. It also lays its eggs in artificial containers, and it got the name eastern treehole mosquito because they lay their eggs in the natural tree holes of maples, oaks, and beech trees. So this is the one that transmits lacrosse virus. So this mosquito is found mostly in woodlots, wooded areas. They're most active during the day in the shade. So if you ever, you get out of the sun and in a shady area and you start getting bit, this is one of those mosquitoes. Mm-hmm. And something interesting is that Ohio has reported more cases of lacrosse virus disease than any other state in the U.S., and it averages about 20 cases a year.
Oh, wow.
So it is certainly a concern, and ODH Lab is now testing this particular mosquito and checking to see if those mosquitoes have lacrosse, and they just started that last year. So regarding West Nile virus, there's something I want people to remember. So approximately 80% of people who are infected with West Nile virus will not show symptoms at all. But we don't have any way of knowing in advance who that is, who will develop an illness. So if you do develop symptoms, it's usually between 2 and 14 days after you're bitten by the infected mosquito. So 80%, that's 1 in 5. So up to 20% of people who become infected will have symptoms that can last for a few days, as long as several weeks. And some of those are fever, headache, body aches, nausea, vomiting, swollen lymph glands, rash on the chest, stomach, or back. So that's a little different than some things, but all of those other symptoms can be a lot of different things. Now, out of that 20%, or that 1 in 5, 1 in 150 people infected with West Nile can develop a severe illness. And the severe symptoms can last several weeks and can have neurologic effects that can be permanent. So the severe illness can be high fever. There's a lot. High fever, headaches, neck stiffness, stupor, disorientation. This one, coma, it can happen. Tremors, convulsions, muscle weakness, vision loss, numbness, and paralysis. So death from infection with West Nile occurs in 10% of those diagnosed with severe illness. So we have 8 out of 10 not showing symptoms. So in that 20%, you can have symptoms. And of that, 1 in 150 can get a severe illness. So it's not really, really high. However, like I said earlier, we don't know how it will affect somebody beforehand. So that's why it's so important to take precautions.
Mm-hmm. Yeah, because you don't know how susceptible you may be, or
right. That's right. Another mosquito that we do see in Ohio, the Asian tiger mosquito, and that is Aedes albopictus. So it is found in nearly all of the southern counties in Ohio. So they have tended to be in a little bit of a warmer climate, which like southern Ohio tends to be. But these are also active mostly during the day in shady areas as well. And they're an aggressive biter.
Oh, yay.
Yes, they are. And so this mosquito was imported in the United States in the 1980s. So it's been around a while. It's spread all over the U.S. because they can survive in temperate weather, not too hot, not polar region, which is a lot of our country. So it has spread all over the United States. So we do have it here, and we did have a few identified every year of this particular type of mosquito. Another mosquito, malaria mosquitoes, they're all in the genus Anopheles. A lot of these are found throughout Ohio. They also lay their eggs in ponds, marshes, and ditches. This is another one that's active from dusk till dawn, like the northern house mosquito. And it can transmit a parasite that causes malaria. Now, malaria was eliminated in the United States in the 1950s, but the potential for transmission is there. So, and these mosquitoes are here. They are identified. So, we keep an eye on it. We don't have malaria outbreaks in the United States, but you always have to track these things to ensure things like that doesn't happen. And the only other mosquito I would like to mention is the yellow fever mosquito. It's Aedes aegypti. Now, this mosquito was the one that was, if you remember, Zika a few years ago, especially in 2016, there was a big outbreak in a neighborhood in Miami, Florida. That mosquito is not established in Ohio because it can't survive our freezing temperatures. So it has been collected in Ohio before, but typically it's because it's been brought here, or maybe if tires are being transported somewhere or something, and the mosquito was in that truck or on that trailer, it's been here, but they don't survive the winter. So as long as I've been involved with trapping mosquitoes, we haven't seen this mosquito. It's a very good thing.
Yeah. So this one's just kind of a stowaway when it makes it to Ohio.
Yeah.
They can stay wherever they came from.
Yeah, exactly. I agree.
Yeah.
We have enough.
Definitely. Yeah. Sounds like we do. If we've got 59 species, that's a lot.
It is. It's a lot.
So what are some things that the health district does to help with mosquito control?
Well, we've been participating in the mosquito control grant that's offered by the Ohio EPA since 2016. As part of that program, we trap mosquitoes across the county in every township and the city of Chillicothe, and we send those mosquitoes to ODH lab for testing. And this is done all over the state, and it helps build data across the state so we know where these mosquitoes are, what they're doing, what their numbers look like. We respond to complaints for breeding sites. We have larvicide that if we find areas that are holding water long enough for mosquitoes to breed, we will take that out, and it will keep mosquitoes from breeding for about 3 months or more. So that's very helpful. We do have adulticide if needed. That's the spray. And we did use it this year. We have information on our website, social media. You're always putting stuff out, information all the time. It was our main topic for our health department health fair this year. We have mosquito spray for the public. We also have larvicide blister packs that we can give to the public that are really great. I've used them around my house. They work. We have information bags that we've given out with pamphlets, and they also have mosquito repellent wipes in there. We try to do what we can to get word out to the public. Mm-hmm. We got that grant in 2016, and we've had it every year until this year. We did not receive the grant this year, and so we had to become a little creative. Typically, with part of that money, we hire an intern for the summer who goes around the county all summer. We've made sure we've hit every township in the county in areas mostly where the public gathers. And we were not able to do that this year because we didn't have the funding. So what we were able to do is try to place traps where we could easily do it and get it picked up. And then other people who work for the health department also helped. So it was, a little more cost effective for us. But a lot of the education and things that our summer employee would do, we weren't able to do as effectively without that funding.
Yeah, it just shows what happens kind of on a local level. As we've heard a lot earlier this year about federal grant funds getting cut for certain programs. Yeah. So this is just one way that you can see how we're affected locally when we don't get certain types of funding.
Yeah, the typical amount of funding was cut down, and we had a very dry summer last year. We were in a severe drought in Ross County, and we did not have any West Nile positive mosquitoes, and that pushed us a little further down on the list, and maybe a couple other things. And so we're going to do everything we can to make sure we'll apply next year and hopefully get funding and be able to return to what we've been able to do the previous 9 years.
Mm-hmm. Yeah, that's one of the things. It's kind of a double-edged sword. We don't want a bunch of dangerous mosquitoes, but then because the funding is need-based, the more positive pools we have,
right.
You have a higher likelihood.
It pushes us up. Yeah. And a point I'll make now so I don't miss it later is we know West Nile virus is here. We know it. But when you're setting a trap, I set a trap near my house, as you did as well. And when you get positive pools, which I did several, and other people here at the health department as well, you realize, and they say, oh my gosh, there's West Nile in my neighborhood. There's West Nile everywhere. So what that does, it just reminds you of the dangers of a vector and the disease they can carry and transmit. And so just keep that in the back of your mind because nobody lives in a bubble. We don't know if that mosquito is one that may be carrying a disease. So just think about that.
Mm-hmm. Yeah, it's kind of scary to think like it could be right outside your back door.
Right.
And probably is.
And it really does make you step back and say, oh, yeah, I probably should think about this a little more. People like me who, step outside for 2 minutes and get 10 mosquito bites. So.
Mm-hmm. Yeah, like last night I got home late and I forgot to water my plants. So I'm out there with all the bugs and critters and I'm like, oh great, I don't have any spray on right now.
That's what my husband did last night, who never gets bit. So that's how I get out of the evening watering. I say, well, you know how I get bit. So, then he does it.
That's a good man right there.
Yeah.
Taking one for the team.
Yeah.
So what are some basic precautions that people can take to minimize exposure to mosquito bites?
Well, first of all, make sure when you're outside, you're wearing mosquito repellent that's registered with the U.S. EPA. So, and typically there are several different things that are registered with the U.S. EPA as effective, but the one that we see the most of what most people go to, Walmart and buy has DEET in it. We also have some lemon eucalyptus oil that is pretty effective. I've used it and mosquitoes love me and it works pretty well. So wear the mosquito repellent. Be especially careful between dusk and dawn. That's when these mosquitoes are most active. Even though we do have our day biters, we all know when the sun goes down, that's usually when we're really getting bit.
The vampires come out.
Yes, exactly. Stay indoors if you can during those times. Wear light-colored clothing, long sleeves and pants to cover exposed skin. And most importantly, stop mosquitoes from breeding around your home. And so often people don't think about where these mosquitoes could be breeding because they do not need much water to breed. Like you and I have talked before, you have a pop cap, the tiny little pop cap, and if it's holding water and it gets a little stagnant, a mosquito can find it and breed in it. So empty standing water from flower pots, wheelbarrows, if you have tarps over things, empty bird baths once a week, empty any containers holding water or trash, something, or like I said, as small as a pop bottle cap can breed a mosquito. So, and here's one that I think a lot of times people don't think about. And I used to live in a neighborhood with a lot of big mature trees. Check your roof gutters at least twice annually because they really will breed a lot of mosquitoes if it holds a lot of leaves and debris. If you have ornamental pools, and I do have kind of a small one, and that's where I put those little larvicide things in because it doesn't run all the time and it loves to breed mosquitoes. But make sure it's aerated or have fish that eat mosquitoes in there because they certainly will breed. And I wanted to mention, because we've gotten questions about swimming pools, if it is a clean circulating swimming pool, it's not going to breed mosquitoes. They're usually looking for still water, brackish water. That malaria mosquito, a little bit more in some moving water, but typically it's brackish and not being used. But if that pool goes stagnant, it's a perfect breeding ground, and they will breed thousands of mosquitoes. And we've had complaints over the years of pools that are holding water, and we have put some of our larvicide in there so they won't breed in there. Also, repair screens on your house. And if you have air conditioning, I know it can get expensive, but if you can close those windows and run the air conditioning, it keeps from getting those mosquitoes in the house.
Mm-hmm. So like you mentioned swimming pools are usually okay because the water's circulating more. Yes. Like hot tubs, fountains, those types of things are usually okay.
Yeah, and they have chlorine in them and things, and that's not what they're looking for. That's not what a mosquito's looking for.
Does the chlorine kill mosquitoes, or do they just kind of
well, they would, but they're just not attracted to that. They're not attracted to the moving water. Mm-hmm. So they just don't go into. Now, if you have an overflow from that pool and it lays in a low area and it lays there for a while, it might breed a mosquito. But a running, working pool is not going to breed a mosquito.
How long does it usually take for the mosquitoes to be able to breed? Does it take a couple weeks?
Yeah. Mm-hmm. Yeah. So that's why, like if you have a bird bath or something that you have whole water, if you could think to dump it once a week, then it's not going to breed a mosquito. Or if it's laid an egg, it doesn't have long enough to turn into the larva, which, then go from there. So
yeah, if you're thinking about a bottle cap's worth of water, that's not very much. Yeah, it's amazing.
Yeah. And remember, a mosquito can travel a really long distance. So sometimes you don't, let's say you get West Nile and you are out in your yard. Well, that mosquito could have traveled from a mile away. You don't always know where it's coming from. So if everybody could take part in trying to reduce we'll never get rid of them. There's water everywhere. There's things that, but anything you can do in a neighborhood or anything to reduce it can help.
Yeah, so you can really help your neighbors out, it sounds like, by keeping your own property free of stagnant water because, like you said, you don't know where those mosquitoes are going to go. So you could have your stuff cleaned up, and then if somebody right next door, if they've got a bunch of standing water, they could come over to your place, sounds like.
Yeah.
Mm. You'd mentioned before also that ticks are considered vector.
Yes, they are. And there has been such an increase in tick-borne diseases in the past several years that I would like to share some of that information as well. It has really gotten to be a pretty serious issue. So there are around a dozen species of ticks that have been identified in Ohio. Most of them are associated with wild animals, but there are 3 I'd like to mention that are associated with humans and our pets that will come into contact that are disease carriers. So they are vectors. The first one is the one that we've all seen all of our lives, I'm older than you, but so the American dog tick, that's typically, when I was growing up, that's the tick you found. When your mom on a summer night was going through your hair and looking, and looking everywhere, that's usually the tick that you were going to find. It's found everywhere in Ohio. They typically like grassy fields, clearings, and other areas with little tree cover. So they're not in the deep woods or anything like that. They're out in areas with, higher grass or fields, things like that. They're active mostly April through September. And the American dog tick is what transmits Rocky Mountain spotted fever. Sometimes tularemia, rarely. And the adult females are most likely to bite humans. Typically, the egg layers, the females, are always the biters, mosquitoes too. So, that's one that we've been well aware of for a long time. The Lone Star tick, called the Lone Star because the adult female has a little white dot on its back. It's also found throughout Ohio, but more common in the southern half of the state because we're a little warmer down here, as what I always say, tropical southern Ohio. Yeah. And they live in woodlands with a lot of undergrowth, and they're also active April through September typically. Nymphs and adult females, so that's kind of the first version of what a tick looks like, the nymph. The nymphs and the adult females mostly bite humans. They transmit ehrlichiosis, hopefully I said that correctly, and southern tick-associated rash illness. But they're also associated with the alpha-gal syndrome. And I think a lot of people have been hearing a lot about this. Yeah. This is the syndrome which makes people allergic to certain things like certain red meats like beef, dairy, and then some medicines that are made from red meats and things, and other things that contain alpha-gal. And alpha-gal, it's a molecule that is naturally produced in the bodies of most mammals, but not humans. So if they're able, through the process of spreading a disease, if they then spread that alpha-gal to a human and you start having the reaction to that, it can be pretty serious, It's not just eating red meat. There's a lot of things, and there's a lot of things made from maybe, cattle that you wouldn't think of, down to maybe some, a chapstick or something like that.
Oh, wow.
And then you're finding out, and I've also heard if you had allergies with alpha-gal, some people have, I've talked to people firsthand that their other allergies were so much worse. So it can really be life-altering for people. So, that Lone Star tick, that's a pretty darn serious thing. So it's been in Ohio for quite a while, and it's here. It's established. The last one I wanted to mention is the black-legged tick, or a lot of people, we call it a deer tick. And this little guy is something. So it's most common in the eastern and southern counties in Ohio, but based on the what ODH has been able to come up with and where they've identified black-legged ticks across the state, it has been established in at least 77 counties in Ohio, and that's a lot more than just eastern and southern Ohio. So it's found mostly in wooded and brushy areas as well, and these ticks can be encountered any time of year when the temperature is above freezing. So the other ones tend to, die off or whatever. But the black-legged tick, you could be out in December, and there's a lot of times it's well above freezing in December, and you could encounter one of these ticks.
So they're a lot more resilient to the cold.
Yeah, they are. And these ticks' activity, they become active in late March or early April, and they usually peak May and June because the nymphs are looking for a host. And the crazy thing about this particular tick, the nymph and the adult can pass Lyme disease to you. So So the nymphs are looking for a host around May or June, and then it peaks again in October and November when people aren't really thinking about ticks, because that's when the adults are looking for a host before winter. So, and like I said, this is the tick that transmits Lyme disease. A deer tick is small, and a deer tick nymph is even smaller, and they're sometimes hard to see. So, to kind of give you an idea, a nymph is about the size of a poppy seed, an adult is about the size of a sesame seed. So quite often people may see that and even think it's a freckle or a mole, and it's a tick because they can be so small. They transmit other diseases as well, and from what I'm reading, it can be associated with alpha-gal. But Lyme disease cases, I was kind of pulling some information, and Lyme disease cases have been increasing. In 2014, we had 121 cases in Ohio, and it has increased almost every year. And as of September 14th, the latest information we have 1,977 cases in Ohio.
Oh my gosh.
In the spring, I attended the Ohio Environmental Health Association, their spring conference, and I went and listened to an entomologist that works for OSU, and he said to us, there were two things he said to us that stuck. One was, I prepared this last week, and it's already outdated. That's how fast this tick issue is increasing. And the other thing that he said throughout it several times, because he said it takes you have to say something at least 3 times for someone to really hear it. His advice to us was don't get bit by a tick ever in your life. And of course we all laughed.
Yeah.
But it just kind of makes you think of the seriousness of it. And how tick-borne diseases are increasing. So I wanted to bring that up just to let everybody know, really pay attention. Yes, mosquitoes are a serious vector, but ticks are as well, and maybe even surpassing mosquitoes.
Mm-hmm. Yeah, I know a couple people personally who've contracted Lyme disease from tick bites, and it's quite an ordeal. It sounds like for a couple of them, it took a really long time for the doctors to even diagnose it and figure out what it was.
Right. Because so many of these diseases, the symptoms are similar to a lot of other things. So people don't think, and even doctors, they are not thinking about what these symptoms are compared to a lot of symptoms. A lot of people get fever. A lot of people have achy joints. A lot of people, don't feel well, or some people have the symptoms of vomiting and things. Well, my goodness, there's so many things. Mm-hmm. So sometimes diagnosis isn't easy based on that.
Mm-hmm. He's like, did I have bad pizza or was it a tick bite?
What's going on? It could be so many things. Yeah.
So what are some ways that we can avoid ticks? Is it comparable to like the mosquito prevention?
That's what I was going to say. It is similar. So avoid wooded and brushy areas with high grass and leaf litter. And if you're out walking trails, walk in the center of those trails. Try not to get off too much. And take extra precaution in the spring, summer, and fall. Although, I will say, think about that deer tick, that it could be out any time of year if we're not below freezing. Use tick repellent, registered with the US EPA. And this can be used for mosquitoes as well, but you can treat your clothing and gear with permethrin. And you spray that on your clothes, and it will last up to, I think, a couple of weeks. And I think it even says that it can stay on with a washing.
Oh, wow.
But I believe so. I think I read that. We do have permethrin here if anybody in the public would like some of that as well. We do have it. Wear long pants, long sleeves, long socks. Wearing light colors will help you see the tick more clearly. Tuck your pant legs into your socks or boots. Tuck your shirt in. Don't give them anywhere to find their way in.
Now, do the ticks, do they kind of gravitate towards certain areas more? Like I've heard some people say that they like to go for the waistband, like those types of areas.
I guess I would say I'm not the expert on that. I don't have the information. I know we always look, around the hairline, around. I would think places like that. I guess I can't answer that question really well for you, but I would look over your entire body. They could attach anywhere.
It's scary to think about.
I know.
Actually, I'm pretty sure I ripped off a mole one time because I wasn't sure if it was a tick. It's so hard to tell, and especially like you said with those
the deer ticks. Yeah, they scare me a little bit, and I found one on me. I mean, I work in environmental health, and for years when I was here before, I worked in private sewage and private water. So I was always out in the field, climbing a fence, in the woods, going through brush all the time, and there were times that I would get back in my car and I'd just be picking ticks off of me and throwing them out the window. And, or it's really creepy when you've been out all day and you've been working and that night you go in to, take a shower and you find a tick that has started to attach to you and has been on there all day. It is the creepiest, yeah. Mm-hmm. But when you spend a lot of time outside and work outside, last weekend I was doing some hiking with my daughter, and there were areas where the path got really small and there was a lot of brush and I was like, oh, ticks. And she was kind of, her mother's an environmental health specialist. I've worked in environmental her entire life. And so, I get the little eye roll. But I'm like, we're checking each other for ticks as soon as we're done.
She should know the risks, and she's been with you all the time.
She knows.
Yeah, fear the tick.
Yeah.
Yeah. Well, we've also talked about vector prevention. You talked about how stagnant water can collect in tires, and we've got our annual tire drive coming up here pretty soon.
Yes, we do. I know there have been tire drives in the past, but since I've been back, I know for sure this is our 5th annual, 5 in a row, tire drive, and we have it every year at the Ross County Fairgrounds. We have signage to lead you back to it. It's going to be held this year, October 11th. From 8 a.m. to 12 p.m. Something a little bit different this year, you still are allowed to bring up to 10 tires. And the reason is because you would be a tire hauler if you were over 10. So if you got stopped and you had more than 10 tires and you can't show that you're a registered tire hauler, you could get in trouble. Mm-hmm. So that's why we say 10 tires. But the other thing, in the past, we took tires on the rim and off the rim. This year, the tire has to be off the rim. So I hope people hear this and know that I hate to turn somebody away that has a tire on a rim, but this year they do have to be off the rim. And one additional thing, a shout out to our public health nurses. We are going to have a flu clinic at the same time. So we're going to try to make sure if someone's coming there just for the flu clinic that they don't have to be in the line for tires. But that is something added. They're really trying to get all over the county to make sure that people can get their flu shot if they want it. So we're also going to have some nurses there with us this year.
Yeah, with a party out there.
Yeah.
So, and the tire drive, it's for Ross County residents only, correct?
Oh, yes. Good point, Sarah. Yes, it is for Ross County residents only. And we will ask every year what township you're from, how you heard about it, and how many tires you brought. So we can kind of keep some data on that.
Mm-hmm. Yeah, so it's free for all Ross County residents, no recycling fees, first come, first serve. And you said it's car tires only, right?
Car tires only.
Yeah, so we can't take like the big ones like tractor tires and things like that.
That's correct. Yeah. That is correct. Only passenger tires. If it's a passenger truck or just, you have a minivan or a van like that, those are considered passenger tires. But anything a little bit bigger than that, unfortunately, we won't be taking at this tire drive, but we are taking 10 for free. So, which is pretty good.
Yeah, that's a lot.
Yeah.
That's a good chunk. And I think you'd mentioned before that the funding for the tire drive event was provided by the Ross County Litter Control and RPHF Solid Waste District.
Yeah. So in past years, again, going back to our mosquito control grant, I didn't mention this earlier, but our mosquito control grant, part of that money went to pay for our tire drive. And a couple of years ago, the Solid Waste District had a grant available, and we've applied for it and got it the last couple of years. We got it this year for $5,000, which we so appreciate, to help towards our tire drive. And we did not get that additional funding because the mosquito control grant. So the litter control, Ross County Litter Control and Recycling, I wanted to make sure I said that right. They have generously offered to cover the additional expenses above $5,000. And so we are so grateful for that. So we're still able to offer that to our citizens. I know a lot of people that come through, they tell us how much they appreciate it. And I know that you have them and you're like, what do I do with these things? And they're expensive to get rid of. So I'm so glad we're still able to have the tire drive this year, and we have support from other agencies in our county helping us make that happen.
Absolutely. Yeah. We've got a great community partners that are willing to help us out. And
yes, we do. Absolutely.
Wonderful. Well, Kelly, are there any other EH-related topics that you want to hit while we're here, or you think we got it?
I think we've got it. Yeah. Just know that, we're out there a lot. Public health is prevention mostly. Everybody in this health department is always out there working in all kinds of different public health scenarios. I think one of the things that's not even environmental that a lot of people don't realize is the infectious disease tracking that happens at every health department everywhere. And there are diseases that are tracked, and our nurses track them, and they try to make sure we don't have outbreaks. A lot of times we will work together. We're making sure if people become ill, we try to make sure that it's not an outbreak. I mean, there's so many things that go on in public health because we're prevention that a lot of people don't see. So I just kind of wanted to give a shout out, I guess, to the whole health department because of that work that we're always doing, and it's behind the scenes.
All right. Well, Kelly, thank you so much for taking the time to chat today.
Thank you for having me.
Absolutely, yeah. Well, if you have any questions, you can visit our website at rosscountyhealth.org for more information about our programs and services. And follow us on social media for updates on Facebook, Instagram, LinkedIn, and X. Till next time, take care and share the health.